IMSI is a technique that is very similar to ICSI. ICSI is the acronym for Intracytoplasmatic injection of the sperm. That means that what the biologists do in the lab is that within all the sperm sample, they look for the sperm that move better, and then they select those sperm to inject them inside the eggs to try to fertilize those. Okay, when we're using IMSI, what the biologists do, they use another kind of microscope with much more potency, and then what they do is also select the sperm according to the morphology of the sperm. There are some small studies saying that maybe in patients who have low morphology, so patients who have teratospermia in the sample, that might help to have better results and to diminish the risk of miscarriage or the risk of having embryos that do not implant. Nevertheless, those studies are very little, not conclusive. There is no robust data or evidence to support that. And in our experience, we've seen very similar results with ICSI or IMSI. So this is why we don't do IMSI in our clinic. One of the techniques that we use, especially when we find alterations in the DNA of the sperm, when we find that the DNA fragmentation is high, we use a device that it's called Fertile that helps to select better the sperm that is less fragmented, and we have seen very good results with that technique, seeing that it reduces the risk of having embryos that are chromosomically abnormal and also the risk of miscarriages.